All right, looks like we're stabilizing at about 52 people. It's just coming onto the hour of 2 o'clock. Want to say good afternoon if you're on the East Coast, good morning on the West Coast, good tomorrow if you're in New Zealand. Want to welcome you to today's Introducing MIT Medical session. My name is Brian Sheets. I'm the Executive Director of MIT Medical, and I've got a fantastic crew of colleagues with me who are going to walk you through MIT Medical's clinical service offerings, our community wellness offerings, our behavioral health offerings, our insurance, and hopefully answer many of your questions as we go throughout. We do have the question and answer set up right now. And so we'd encourage you to put all of your questions in the Q&A, and we will work to answer them either real time or as we go along. If you don't have your question answered right away, we might be about to get to that in a future element of the presentation. So just be patient with us. If we hit all of our marks, we'll have some time at the end as well. So with that, I'm going to start introducing my folks. We'll go through and do some presentations as we go and then have questions. So first, I'd like to introduce Dr. Sean Ferrulo. Sean, take it away.
Thank you, Brian, and welcome everybody. As Brian mentioned, my name is Sean Ferrulo. I am the Associate Medical Director for many of our clinical services here at MIT Medical and oversee our student health functions. My clinical background is family medicine and non-surgical sports medicine. We'll introduce MIT Medical. If we could have the next slide. I think our agenda will be that first slide there. So as Brian mentioned, what we'll do is introduce ourselves as we go through our sections. I'll give an overview of our clinical services. We will then hand off to Karen for our student mental health and counseling. I think Brian, you'll do the health plans, and then we will get into Katelyn and our community wellness and have time for question and answers. So next slide. We will, as we do this, we will try to be as informative as possible with questions that we know are common, and then we'll get more personal from there, or more pointed from there, if you will. So for those of you who may or may not have been to campus, this is an aerial view of a part of our campus map. The bottom right corner there is the Charles River. Over on the left, you can see the circles with the number 10 on it, which is the main entrance of MIT at 77 Mass Ave. And MIT Medical there is labeled at E23, which is our building. We are just behind the Kendall Square train station near the Marriott Hotel, but a little more on the east end of campus. Next slide. So our overview are some hours of operation. So we do have full primary care services, MIT Medical Services, the MIT community. So we're a little different than a standard student health. We take care of faculty, staff, employees of MIT, family members and dependents of employees, as well as graduate students, undergraduate students, and for graduate students, their dependents and families as well. So our primary care services are open Monday through Friday, 8:30 to 5 p.m. We do have a walk-in urgent care component to MIT Medical that is open Monday through Friday, 8 a.m. to 8 p.m. And then on weekends and holidays from 10 a.m. to 4 p.m. We do have access to clinical advice 24 hours a day. And during the daytime, that will be through our triage nurses, and in the overnight time, that will be through an answering service with a nurse and a clinician on call. So one or two important 24-hour numbers. So urgent care, which you see listed here, 617-253-1311 is a number that we do share with students. We ask for students to plug that into their cell phones, typically at orientation events, so that in the event that they were to need it, they don't have to look it up. They know it's there, even if they don't memorize it. That will get them to our same day services during the day, but our answering services in the evening. And for student mental health and counseling, there's a daytime phone number as well, 617-253-2916. And then the same urgent number after hours and on weekends will get you to both services if someone were to need to call, but I'll let Karen speak about that a little bit more. Next slide. So here at MIT Medical, I think one of the things I like to say is that we like to think of ourselves as a community health center, if you will, and our community that we serve is the MIT community. So as mentioned, we have both primary care and urgent care services. We have a student mental health and counseling service dedicated for students and assisting them, and we'll hear more about that in just a little bit. We have an OBGYN department. We have an eye clinic, an eye service. We have radiology and lab on site. We have a sports medicine and orthopedic department, a dental department, community wellness that has wellness programming and others, and more, including some specialty services that partner with us. So we do have a relationship with BU Dermatology Group and have dermatology services on site, as well as some allergy services on site as well. Next slide. So we thought I'd spend a little bit of time on how we've managed COVID through this past year and what we're anticipating. So MIT does require a daily health attestation or a symptom reporter, if you will, each day of community members, as students as well. We do have a surveillance testing program with reverse transcriptase PCR for anyone accessing campus, regardless of their vaccination status. So at this point in time, we are testing our community once weekly through the summer. This will be evaluated as we have higher density on campus and as we monitor kind of the pandemic and the Delta variant or other surrounding scenarios. Within this, our campus access is tied to this testing and attestation. So no student will ever be locked out of their residence or dorm or place of living. But campus buildings may be, if people are not up to date or keeping up with the testing and attestation requirements. We do have a fully robust contact tracing team that has been now functioning, well, pre-COVID on things such as measles and mumps and other infectious diseases. And since COVID, pretty much 7 days a week, 24 hours a day, where we are monitoring all of our COVID testing, positive results and close contacts, and partnering with our local Department of Public Health on necessary pieces, but we're doing our contact tracing on campus and managing that actively within our group. This testing is free for students, and it is available on weekdays from 6 a.m. to 6 p.m. Important to mention, I believe for the next 3 weekends, as we go through move-in weekends, we will be testing 7 days a week for the next 3 weeks. And being able to assist with student arrival, testing on arrival, and other pieces so that we can have as controlled and safe a reentry to campus as possible. MIT is requiring, I'm sure most people are aware or have been notified, COVID-19 vaccinations for all entering students, all returning students, as well as all faculty, staff, and employees. This requirement can be fulfilled one of 3 ways, either being vaccinated or having an approved medical or religious exemption through that process. There is, and I'll give a little shout out to our webpage and our communications team that has been posting very significantly high quality updates, stories, questions, and information on COVID at the MIT Medical webpage. And that website is here, medical.mit.edu. Certainly something we promote for anyone who is interested in having more information. Next slide. So one other piece that is often a common question is around confidentiality. So in Massachusetts, all matriculated college students are considered emancipated minors, even if they're under the age of 18. So if there is a 17-year-old matriculating into college living on their own, in Massachusetts, they are considered emancipated minor. And then, of course, as we all are navigating, my son has just turned 18, my oldest. Our children, once they hit 18 within federal privacy laws, are apply as adults, and those privacy pieces come along with that. So with that, these HIPAA laws we are not permitted to just share information without the student's permission, unless if it's a life-threatening emergency. Privacy rules are do allow, obviously, communication with family members under extreme circumstances or life-threatening circumstances. And of course, we would do that. A common question that we get is around healthcare proxies. In Massachusetts, if someone does not have a healthcare proxy, automatically their parent, if they're a child, would be their healthcare proxy. And that would kick in immediately. Even with a healthcare proxies do not become active until someone is unable to have the capacity to make their own decisions or in a life-threatening situation. With this, I think we want to say always the message that I want to stress is we are always happy to partner with parents and or guardians of our students. Students can give permission to speak with their parent or their guardian. We oftentimes will ask students if they would like that. Many of us, I've held visits on speakerphone so that we could have joint conversation if the student desires and asks for to. But one of the important pieces is to recognize that the Hipaa laws allow for a permission for a one-time episode of care, but there are not provisions within federal Hipaa laws around blanket permissions, meaning I want to give so-and-so access to my medical record anytime they want for everything. We will advise and help students through all of these processes. We oftentimes recognize that part of this education is also educating them to be patients on their own and wise consumers of healthcare. And we recognize that as a responsibility as an academic institution on top of taking high quality care for their health. Happy to answer anything that comes up on that, but I think always that last bullet is the one that I like to emphasize, is that we are always happy to partner. We can always listen, and we can absolutely partner and share information with the students' permission. Next slide. So Karen, I'll let you introduce yourself and take over from here.
Great. Thank you, Sean. Good afternoon, everyone. My name is Karen Singleton, and I'm also an Associate Medical Director here with my wonderful colleague, Sean Ferrulo, who just presented to you. And I'm also responsible for the behavioral health services on campus. So I'd like to talk today about student mental health and counseling, tell you a little bit about what we do, and also answer any questions. So at Student Mental Health and Counseling, we see nearly 21% of the student body each year. And that's important to emphasize because we see a lot of students about many concerns. So mental health is something that we prioritize here at MIT and we take very seriously, and we want students to feel comfortable seeking support. About 29% of students come to us before they graduate. We're also very confidential, and we take confidentiality very seriously. So we don't talk about visits with parents, with friends and professors, and this is something that engenders trust among the students that we see. We only talk about the visits if we need to in case of a dire emergency. Next slide, please. Students come to us for many reasons, but some of the more common reasons are anxiety, depression, relationship problems, and this can be romantic relationships and also relationships with roommates, with classmates, with PIs, with professors, and various people. It can be familiar relationships, so things that are coming from families of origins, but also relationships with graduate students and their families. Students come to us around eating concerns, also because of trauma and substance use and abuse. Next slide, please. How we help. So we do individual and group counseling. We see students generally for short-term therapy. And we also do medication evaluation and management. So there are students that we see for a variety of concerns and reasons. We see students for urgent care, and we do like to stress this because it's important to know that we have wraparound coverage. If a student needs to come to us on the weekends, we have on-call that's available during Saturdays and Sundays and after hours. So there's always someone available to talk to a student. We also offer advice. So students come to us sometimes when they want to talk about themselves and their own issues, but also lots of students come to us when they want to talk about how to help a friend. And that's an important part of what we do as well. We do a lot of community outreach and engagement and helping people with how to think about how to support others. Next slide, please. Now we're going to talk about insurance, and I'm also happy to answer any other questions. I saw that there was a hand raised, so someone can put the question in the chat and we'll continue to talk about mental health counseling. Thank you.
Thanks, Karen. I'm going to take the insurance section, but I also want to take an opportunity to introduce Katrina Askew from our insurance team, who is really here to help answer questions about the operations of MIT health plans. So when we're talking about student health plans, all MIT students are covered by what we call the MIT Student Medical Plan. That's included with tuition and pays for most services in MIT Medical at no additional cost. The best way to think about it is it's basically the health fee. Now, unlike many universities and colleges, we have a very large medical center here at MIT Medical. And so that health fee covers a lot of things. And it best described as covering basically everything that we offer at MIT Medical: urgent care, primary care, student mental health and counseling care, some targeted specialty care offerings that we have. The things it does not cover are pre-matriculation vaccines. So vaccines required to enter college or university per the state of Massachusetts. It does not cover obstetrical care, primarily because those are significant, high, one use expenses that really we cover through insurance, and it doesn't cover prescription drugs. The second product and offer is the MIT Student Extended Insurance Plan. There was a question in the chat before about, should I get the extended plan? What does it add on? What's the extra? It's actually not an extension of anything. It's really just a great insurance plan. It complements the MIT Student Medical Plan, meets all the state requirements here in Massachusetts for minimal essential coverage, as well as the ACA requirements. And it's designed to work together. So it's a full-fledged Blue Cross Blue Shield PPO plan with quite a low premium and quite low copays at the end of the day. Students are automatically enrolled in this plan. So full-time students are automatically enrolled unless they waive coverage. We'll talk about waivers in a second, and those costs are billed to your student bursar account, your tuition account. Spouses, partners, and eligible family members are eligible to sign up for insurance as well, and all the rules and requirements are on our website. We can go forward a slide. If you are already enrolled, perhaps through parents' insurance, you can waive the extended insurance coverage if you have a comprehensive insurance plan that meets the state's requirements. And those requirements are important. It's not just that you're enrolled in a plan. You have to be enrolled in a plan that provides good benefits and has providers accessible here in Massachusetts. So what does that mean in practice? In practice, it means that in many cases, if you have an out-of-state Medicaid plan, that will not meet the requirements. If you have an out-of-state HMO with a regional or locally limited network, a good example being Kaiser Permanente in California, that will not meet the requirements. The best things would be national network PPOs or plans that have significant regional networks here in New England, if this is where you live. If you waive the coverage, that process happens through our vendor partner at Gallagher Student Health. You can see the website down there. The waiver deadline, I think Katrina can correct me, but it is basically right now, if not slightly past. If you have any questions about that, you can email the student health plan team in a moment and we can work with you on a case-by-case basis. A note in the questions, when you do waive, the charges will be reversed on your tuition account, but it can take a bit of time for that to happen. So be patient with us. It can take up to 10 business days, and we always have to work together. Question about the timeline of that plan. The first day of coverage is September 1st, and that coverage runs through the end of August in the following year. If a student graduates early, they stay on that plan through the end of the term in which their graduation happens. So if they graduate in December, their coverage would end at the end of January, that first term. If they graduate in the summer, their coverage would continue through the end of August. And you can be renewed in future years as you continue to be enrolled as a student at MIT Medical. You can go to the next slide for me. If you have questions, here's our MIT Member Services team. In addition, we can share information about the Student Health Plans team who can help walk through any of these questions. I'm just looking in the chat, see if there's any others I can answer here. Flu shots are free at MIT Medical. Actually, they're free at MIT. We run a huge vaccination program for flu every year. And that's something that we do without even charging insurance. It's just part of what we do to keep the community safe. And then there's a question specifically about whether an individual plan meets the requirements. That's not something I can answer live with you now. It will really depend on whether that plan has the right provider network here in Massachusetts provide access. That's really what our vendor partner is able to provide. One thing you should always note, you have to be enrolled, actively enrolled in that plan. So that was something also they'll check. And then question about MIT medical insurance working for within MIT medical, how that insurance works. For the vast majority of services that we've talked about so far that Dr. Fullo and Dr. Singleton have talked about, those services are paid for by the MIT student medical plan, that fee I talked about. We won't even ask insurance for those. For prescription drugs, again, we cover those things included in the questions. We cover those for students who are enrolled in the MIT medical plan. Excuse me, the MIT extended plan for those, and they can pick up an MIT Medical's pharmacy. I'll take a break. We'll do some questions in the chat, but I'm going to take the opportunity to introduce Katelyn Mccourt from MIT Medical's amazing community wellness team to talk about the work that we do to keep the MIT community healthy and well.
Thank you, Brian, and hello, everyone. My name is Katelyn Mccourt, and I work as the Director in Community Wellness at MIT Medical. And here I'm pictured with my lovely colleagues. I work with a wonderful team, and also we contract with several wellness instructors and acupuncture providers. And we work alongside our campus partners across the Institute to create a network of support for students. And we believe that well-being is core to students' educational experience, and that by taking care of your body and mind and fostering meaningful relationships, that students can thrive during their time at MIT. Next slide. As a new or returning student, developing a wellness toolkit early on in your time can help you take better care of yourself and one another. And Community Wellness is here to help. We offer programs and classes to help students stock their toolkit with strategies to address topics like stress, sleep, healthy eating, physical health, and opportunities to foster social connections. Next slide. We offer a variety of virtual, live, and recorded classes, including several mindfulness-based stress reduction courses, where a lot of our students report that they are less stressed, have better sleep, and live with greater mindfulness and self-compassion. Throughout the year, we offer a variety of different types of workshops and classes to address topics like productivity and time management, sleep health, and strategies to cope with everyday challenges brought on by the pandemic. And we do this by partnering with our colleagues across the Institute and also with student mental health and counseling. We provide many programs to help foster community connections, like our annual exercise challenge that takes place in the wintertime called Get Fit. And it's a team-based support and motivation to help set goals and remain active during cold New England winters. And we also have an undergraduate program called MedLinks. This is a group of trained student volunteers, and they serve as a resource for students living both on and off campus. MedLinks provide single-dose, common over-the-counter medications and first aid materials to students living in campus residences or FSILGs. We've realized that students may not need this information today or next week, but we're always here to help connect students to the right resources at the right time. So we encourage students to just have a low threshold for reaching out and asking for support, and we are here to help. And next slide. So we have several different websites listed here that are popular and helpful. And I think now we'd like to turn it over for some live Q&A.
Great, thank you, Katelyn. Before we jump into any additional live Q&A, I did want to, maybe Sean, I can have you go back and talk a bit about a question that was answered in the chat, but I know it's one that's on people's minds. Can you tell us about what happens if a student tests positive? Maybe start at the beginning with who contacts them, and then what's the process for ensuring that they get both the right medical care as well as the right other supports?
Yeah, happy to, and certainly one that I think is very important to talk about and have some awareness on. So as mentioned, we do have our campus testing program. We also have clinical testing if an individual was not feeling well and needed testing. Any positive result, our contact tracing team gets a notice that there's a new result within our secure portal. We go in and find that, and we notify our community members very quickly once that positive result comes in. For students, that contact tracing team is a core group of us that have been doing this now for, hard to say, a year and a half or so, but it's been a year and a half, maybe even a little bit longer. And have quite a strong amount of experience in this. Our first emphasis always is to inform the positive person if they have not seen their result, to be sure that there is no ongoing exposures to anyone within the community, but even more so to make sure the individual who tested positive is okay, both obviously medically, but also emotionally. There are different reactions to learning that someone has tested positive, given personal experiences and other reasons. So we quickly will kick into care mode and making sure that individuals are feeling well, have everything they need from a medical perspective. Once we are comfortable with that, we will transition that phone call into more of the contact tracing. So where they have been, who they've been with, from a purpose of community contact tracing. Within that format, we do have isolation spaces set aside within the residential life services. And there is an amazing team through our Division of Student Life and the Student Support and Wellbeing section that is our as a COVID support team. There is a core group of individuals then who activate to support students. We stay involved for the medical perspective and they activate from the campus perspective. So they make sure that there's assistance in moving to isolation. If students live locally or a family wish to pick up their student who are positive and they are comfortable and wish to drive them home, we do allow students to do that. We give advice, we work with families, we work with the student. We are following CDC guidance. So there is a full 10-day isolation period, irregardless of symptoms when someone tests positive, and also irregardless if they're vaccinated or unvaccinated, if they test positive as well. That same COVID support team makes sure there's academic support, any supplies needed, any meals, everything is taken care of and brought to the student and coordinated in that standpoint. So that is maybe the quickest summary to put there, but each case has a little different flavor, different reasons.
That's great, Sean. Maybe you can do a couple quick bits of follow up here. So what happens for students with roommates? Where do they go when they test positive?
Absolutely. So any student who tests positive will be moved into the isolation housing. We will do contact tracing and determine if there is an exposure to the roommate or not. And then current contact tracing rules will kick in and depend on if that individual is vaccinated or has an exception or not vaccinated, and then the appropriate quarantine will be given. And then there is a question about what happens if you've been contact traced. So we continue to support our positive individual, but also we have direct connection to any close contacts and offer the same support to any individuals who have contact, advise them on testing, help them get testing, and also monitor them very closely through this process.
Great. And I got me one last question there, Sean, about about early exiting of the isolation period.
Yeah, so at this moment in time, campus policy is the full 10-day isolation period, symptom resolution or not. One of the issues with repeat testing is that we know with very sensitive PCR testing, individuals can still shed virus even after they've recovered with dead particles. So the using a negative test, and people can intermittently shed virus. So we have not been using a negative test to release from isolation sooner. We will continue to monitor that and evaluate that with vaccination statuses and with information as that comes through.
Great. Thanks, Sean. Karen, maybe I'll come to you for a quick question. Maybe you could do just a couple of minutes on how you and your team work with campus partners, whether that be the Division of Student Life, and talk about things where you work with the broader MIT community to keep students safe and well.
Sure, Brian. both Sean and I work very closely with the care team network to keep students safe and well. And it's our pleasure to meet with them regularly to ensure that students have as much support here at MIT as possible. That's a network that consists of disability and access services, of SQ deans, of the Office of Graduate Education, grad support deans, and the care team itself. And that's a team that really looks to make sure that all students that are here at MIT who might be struggling with various issues, it could actually be a short-term issue. They could have gotten injured when they're playing a sport. They could be dealing with a chronic medical illness, or they could be dealing with a chronic mental health issue. We want to make sure that those students have the support that they need on campus. So we offer check-ins for those students, and we try to make sure that those students feel that they can be checked in throughout campus so that they don't just have a support in one office, but the support is spread throughout campus. So it can be with various deans, it can be with the Office of Multicultural Education, it can be through all different offices. And we just want to normalize seeking help. And that's something that we really value here at MIT, and we want everyone to know that.
That's great. Thank you, Karen. Maybe Sean, I'll have you answer a question we have there about how do I know if my doctor at MIT Medical is within my PCP network? In fact, I look and I think I've got a great network, but I can't find any doctors at MIT Medical. What's going on with that?
Yeah, very happy to. I was trying to type an answer, but this is probably best verbally. So it is quite true. The MIT Medical is a closed healthcare system, if you will, that is open to MIT community members and MIT health plan members, students included. So you will not find most MIT medical providers listed in outside insurance networks for that reason. For this reason, we often advise students and use terms with students around a campus care provider, in that recognition that students can maintain their home PCP for care when they're home, but have a campus care provider who will partner with their home PCP and who can be happy to share information back and forth for continuity of care and those pieces. So the same is true for the flip of this question. A student can have a campus care provider named within our service that does not affect your outside insurance, since we are an internal system. And that is something that we will work with and work on with students as well.
Thanks, Sean. I've got a question here about insurance that I can take live, which is about graduation timelines. So I think I mentioned before, the insurance will be active until the end of the term in which the student graduates. So if you graduate in December, the term runs through the end of January, and your insurance will be active through the end of January. If you graduate during the summer as sort of a standard graduation timeline, your insurance will be active through the end of the summer term for us, which is August 31st. We do not extend beyond that period, and we don't insure alum through this product. Katelyn, maybe I can come to you for a second. Can you talk a bit about the sort of alternative options for care that the MIT Community Wellness Program offers, particularly maybe a moment about our acupuncture offering?
Sure, thanks, Brian. So for all students who are enrolled in the extended health plan, they are eligible for 20 visits of acupuncture throughout the year. So we contract with a local provider here in Cambridge called New England Integrative Health. And so a lot of students would visit this practice to receive services for acupuncture or gua sha treatments. And most students who seek treatment are looking for potential pain management if they've suffered some sort of injury. Acupuncture can also be beneficial for stress or sleep issues, allergies, migraine headaches, TMJ. I mean, the list goes on and on. So that actually is a relatively new benefit offering that we have. So for students who are on the extended plan and looking to see an acupuncturist, we can certainly help, although students don't need a referral from a provider. This is something that you have as part of your plan that you can seek care. And I would just encourage people who are maybe remaining on their home insurance plan, through their parents, that you can also see if your plan covers acupuncture. More and more plans are, but it's important to just double check.
Thanks, Katelyn. We've got a couple of insurance questions here, but I think maybe Sean, I'll answer one and then I'll pivot to you to expound upon it. So a question about if we live out of state and if we get a waiver, can we still go to MIT Medical for an appointment or urgent care? And the answer is yes, absolutely as a student. But maybe I could ask you to talk for a minute about MIT Medical's urgent care offering, what it is, who it serves, and how it can help for students.
Yeah, very happy to. I think a couple different pieces on this. So absolutely, students can come for medical appointments anywhere in our building, and certainly for urgent care included in that. Our urgent care service is quite robust. We have 3 full-time emergency room physicians on staff, as well as nurse practitioners in that service. It is a balance between a walk-in service and a reserve a spot ahead service, if you will. And within that, our providers are quite capable in caring for a multitude of issues and have that care. For students, especially if they are healthy and well and not connected to a campus care provider, then urgent care can be one of the easier ways for them to get into the service for care. For a student who is established and has met a campus care provider, and if the reason for visit is urgent but not emergent, if you will, students can still go through the primary care services and team and see if there's a same-day care visit available for them that fits for them. And if not, then urgent care certainly will be available, and certainly into evening hours as our primary care service closes, urgent care is still available.
Thank you, Sean. Karen, maybe I'll come back to you. We've got a question about a list of the mental health support groups on campus, but maybe I can have you take that a little bit bigger and talk about the role of group-based care in your service.
Certainly. So at our service, we really value group-based care. Students find it very helpful to be around other students who have experienced similar issues. And so typically we have around 18 groups running at a time. Right now, those groups are virtual, but those groups have been very helpful. So we have groups around anxiety, groups around depression, we have general psychotherapy groups, we have groups for skills building, we have eating concern groups. So I would encourage anyone who's looking for services for individual therapy to also consider group therapy as well, either as something that they want to try in addition to individual therapy, or something that they might want to try in lieu of individual therapy. And when someone calls us, they can talk to our access team, which is our walk-in service, about what might be right for them. We like to partner with students to figure out what's right for people, because it's not really a one-size-fits-all. And we might decide with someone that they might like a once-a-week type of therapy, and we often refer people off campus for once-a-week therapy. People are looking for more in-depth work. Sometimes people are looking for procrastination groups. So people are looking for all kinds of things when they come to us, but the access clinicians who work on the team, they work with students to figure out what's going to work best.
Thanks, Karen. Sean, forewarned, I'm going to come to you with a COVID question in a second, but Karen, you mentioned in your little talk there about the word virtual. And I think a lot of folks are curious right now, what is the expected balance between virtual, telehealth, and in person? And how are you and the team thinking about that balance?
That's a great question. So that, I think, is to be determined, because we're trying to figure out right now what students prefer. We have students who have really enjoyed being seen virtually, and some students actually prefer that modality. And we have students who are very eager to come back to the service. So what we're doing is taking a more customized approach. We'll have students who will be coming in and seeing their providers in person, and we'll have students who will be continuing to be seen virtually. So we're really offering people a menu of options. So they'll be able to come in and they'll determine with their provider. It'll it'll be a discussion that will happen between the provider and the student about what type of modality best suits them. As I said, the groups will remain in person. For now, we've decided that it's actually, I actually run a group myself, and I found that it's easier right now to have the group participate with each other virtually because they're not wearing masks. And so they can connect with each other online more easily than if we were sitting in a room with masks. So right now we're keeping the groups virtual, but we're going to continue to evaluate that. And the individual sessions, we'll be having students coming in person, and we have students coming now. So it's been exciting for people to do that. And we're just seeing what students like. And usually we drive our decisions that way. And it's been fun to see.
Great, thanks, Karen. Sean, maybe you can do a quick answer in general terms on how do I connect up and transfer prescriptions, or if my child has an incoming condition, how do I connect up with the MIT medical team? And then we'll spend a couple minutes maybe talking about COVID and COVID testing on arrival.
Sure, happy to. So in the event that a student is coming to school and is on a chronic medication for a medical issue, a couple different pieces. Certainly upon moving, making sure that they have a month's supply of their medication to get them started, recognizing that our students will oftentimes have many different things that they're trying to attend in the first few days and weeks of school. Within that standpoint, we can assist students in connecting to a campus care provider who could feel comfortable taking over prescribing of that medication and monitoring of that medical issue if it does require monitoring, and assist the student in getting those medications. Certainly, for conditions where people are well hooked in with home providers, or home providers feel comfortable prescribing to a CVS or other in the area, students could do that still and pick up medications that way. But we typically would advise students, to think about making that connection to a campus care provider. For reasons of partnership, for reasons of if something is worsening and they need evaluation, for reasons of prescribing and efficiency in that, in anything that could arise over the course of the semester and academic year.
Great, thanks, Sean. Maybe we'll do a couple moments on COVID testing on arrival, and maybe you can talk about the broader arrival process. I think in one of the answered questions,
Yep.
Already noted that vaccinations are not required currently for parents who are just doing move-in. Question about testing for parents who are doing move-in, also not required, correct?
Correct.
But MIT has a very strict masking policy, and want to make sure
Yep.
that we mention that. But maybe talk a bit about what that first few days, first few weeks will look like for students who arrive.
Sure, happy to. And I do want to emphasize the fact that we have a plan on arrival. We hope and advise all of our community members, as people are aware, for vaccination, and their family members. There is not a vaccination requirement, but we are managing move in and transitions with other layers of safety, certainly strong masking requirements, scheduled times for move in, and some monitoring of density and other pieces to be sure that that process is safe for our students and their family members. Within that realm is how we'll be managing that. For students on arrival, as mentioned earlier, our testing program will be open through the weekends of move-in weekend. We will be asking all students to test on the day of arrival, which is also why we're open through the weekend, but then also on day 4 and day 7 after arrival. So we will be doing a pretty aggressive testing program through this transition process as students are moving in and as our residences and dorms are moving back into capacity. At that point, we will work with any and every student if there are positive results, as we mentioned, but then we will also then transition more into a regular testing cadence after that first week of arrival. And that testing cadence or amount, as mentioned, will be determined based on, the incidence of COVID around us, what we're seeing in our community, both the MIT community, the Cambridge community, Boston, and the Commonwealth of Massachusetts. And that will be all quite apparent and clear for students on arrival. There will be very little chance to be confused because there'll be many of our community members helping and assisting, and our test centers open. And maybe, Brian, just worth mentioning, I'll throw in, we are actually also converting this week to unobserved testing. We have FDA approval and authorization on that. We will be assisting all students for their first test on an observed sample to be sure if there's any questions, to review the testing program. But then our community will be moving to having a kit at home, and through our amazing COVID Pass app, the ability to register that test, swab themselves, and drop off, which will also assist in I guess we'll share with the community that we've done over 800 and roughly 15,000 tests since August 16th of 2020. So it's we are quite experienced in testing, and this will even reduce the barrier for testing or any sort of difficulty or time management issues for testing by making it even smoother.
Great, thanks, Sean. And there's a quick question about where and when do we schedule move-in? That's something you should connect with the office the first year, or the relevant parts of the Division of Student Life, Dean of Student Life team, who can walk you through all of that. A couple of questions about unvaccinated students, and maybe we could take a beat back, Sean, and talk for a second about who is unvaccinated on the MIT campus, given that MIT has a very strict and stringent vaccine requirement. And I can say for example, that we expect that 98% of folks on campus or higher are going to be vaccinated. There are exemptions for religious and medical purposes, but maybe talk a bit about, will they be tested more often? How do we do that whole balance between
Sure.
vaccinated and unvaccinated?
Yeah, this is a really, really wonderful question. I will try to be brief but complete, because this will hard to summarize a year of planning. We have a various number of teams, one of them being the COVID monitoring team that met every day for the last year, is currently meeting 3 times a week over the summer, and likely will go back up for campus monitoring. Within that, we've partnered with many MIT faculty and our medical clinical teams and experts around setting up an entire program for our entire community to be protected. I think the safest way to think of this is we've set our parameters around caring for our most vulnerable community members, if that is an employee, a student, and all of that. So unvaccinated, immunocompromised, and all of that. MIT never released our indoor mask mandate through the entire summer for these reasons. And I think what's safe to think is that we are looking at this from a collective community perspective of MIT protecting MIT, and all of us having responsibility in that, or a piece in that. So our masking mandates certainly is something that comes to play. Our testing cadence, how often we test, also comes into play. But so we were not testing unvaccinated individuals more than vaccinated, but we are testing our entire community, vaccinated and unvaccinated, at the appropriate rate based on many of our scientific predictive models around managing transmission of COVID. We have Brian, I know you've seen this extensively, and others, an amazing scientific model around looking at the R0 value. So the R0 value is if someone has COVID, how many people will they transmit that to? Our entire model is based off of having an R0 of 1 or less, meaning that when COVID does happen, that if our policies are followed predictively and scientifically, there will be no spread through campus activities. Now, with that said, off campus, evenings, weekends, other things could. But using that model to really set our standards with our benchmark of our most vulnerable or individuals, and all of us partnering in that, rather than segregating 2 separate sets of rules for different pieces. And then, as you mentioned, we will have a very high percentage of vaccinated individuals on campus. Even with the exception process, we still have an extremely high rate and very thoughtful community.
That's great, Sean. And I think, I can speak for, I believe, all of my colleagues on this call to say that throughout the pandemic, MIT Medical and the broader MIT community has really done exceptional things in partnership to make the campus as safe as possible, to make it a place where students, faculty, staff can come, be together, learn and work. And we're committed to continuing to do that. There is a quick question about if a student is tested positive and requires quarantine. Sean, I can just say that COVID care team takes care of all those pieces, from dropping off food to ensuring continuity of education, to doing quick check-ins, to engaging Karen and her team in the event that student has some behavioral health needs in that moment. So it really is a full wraparound experience. Maybe Karen, you could just do a second on behavioral health and COVID and what you and your teams are doing, both for folks who have tested positive, but also just the broader experience in this community.
Yes, it is a full wraparound service. I mean, there are students who have tested positive, and there are students who are just anxious about COVID or concerned, or have family members that they're worried about. And we have offered services to those students. We have run groups virtually for those students, and they've been very well received. So there is a lot happening in our community to support students around COVID. And we've been very happy to partner with our campus partners and colleagues around that.
That's great. Thank you, Karen. Sean, I think there's a question here in the chat that you could type, but it would probably be a long answer. So maybe we can do it real time. These are the kinds of other forms that might be submitted for accessing students' medical records. So maybe talk about what we do and don't accept, and maybe a bit about why.
Yeah, happy to. I mean, this is a great question, and certainly with children going off to college, one that is obviously very important, but oftentimes confused as well. So we do have Hipaa waivers, as mentioned earlier. The Hipaa law allows permission to share information for a single episode of care. There is not a Hipaa waiver that exists for full access to medical records whenever desired. And so we do accept signed Hipaa waivers, but it would be for specific aspects of care, and that would be on file within medical records. But oftentimes even verbal permission and a verbal request by the student is oftentimes enough. In terms of medical power of attorney, living will, in Massachusetts, if and when an individual is in a life-threatening emergency or does not have the capacity for medical decision-making, the first point of contact would be family and parents for a child of college age. So these forms we can accept, we can put on file, but they automatically, in Massachusetts, in healthcare law, the parent would be the immediate contact if necessary. Also important to note that we can accept these and hold them, but these are also dependent on location of care. So if a family does have this completed, it is on file at MIT Medical, an emergency event happens outside of campus and a student is brought to Mass General Hospital or a local Boston emergency room, they would not have that on file. But again, in Massachusetts, the parents would be the immediate point of contact. Oftentimes, just to give some real world experience on this, hospitals are very attuned to seeing like an MIT ID on a student and calling and getting connected with the medical department, getting connected for information, activating services, activating communication, which is the same in those formats. So certainly if people desire and wish to have these, we can hold on to them and we can file them, but they are within Massachusetts, the process that will happen even if not officially on file.
Thanks, Sean. Maybe Karen and Sean, I'm going to have, if you will, collectively answer the question about what happens when a student gets very sick, whether that's COVID or as a medical condition, whether it's behavioral health condition. You can talk about how MIT Medical and our campus partners support in those circumstances. And maybe Karen, you can talk a bit about the care team piece, and Sean, some of the clinical coordination.
Sure. I'm sure Karen and I could both talk about it extensively. Karen, do you want to go first?
Yeah, Karen, why don't you kick off?
Sure. Well, when students typically get very sick, there are a number of things that need to happen. Of course, there are the logistics that need to happen in terms of their coursework, and that's something that the care team often manages. They're in contact with professors, with deans, and they make all of the arrangements that the students need in those areas. But our primary concern at MIT Medical is, of course, the students' health and well-being. And so we're really attending to that. And we work with the care team to make sure that the student doesn't have any discontinuity in their academic area and their life and well-being, and with their housing and relationships and friendships, and that all of the care is coordinated so that the student feels supported. Something that we do at MIT Medical that is often reassuring to families is that we always ask students who they would like us to contact. And in our experience, when we suggest to students that they contact people, either close relatives, family, they are usually very amenable to doing this. I think a lot of times families are concerned that students will not contact them, but we often, when we talk to students, we will recommend that they would be really in the best care if we contact people on their behalf. So we will say the care team would be happy to contact your professors. We need a release to talk to the care team. Are you happy to sign the release so that we can get that going? We would be happy to contact your family. We would be happy to contact your roommates. So there's a lot of discussion when someone is struggling about reaching out, because the last thing we want is for students to feel isolated. And one thing that we can offer to students at MIT that, Sean and I feel is very unique to MIT, and that's why we love working here, is we feel like we can offer students a unique set of resources and a support system. And we really don't have students falling through the cracks. And that's something that we love about working here. So that's something that we offer to students. And because we have good relationships with students and we know how to build rapport, and we all have staffs and teams of students, of staff who've been doing this for a really long time, they know how to talk to students and they know how to build rapport. And we often have very positive outcomes where students are very willing to let us make those connections.
Yeah, Karen, and I think I'll just add to that, and we say this a lot, and it is true, the safety network, if you will, or this network across campus is very large. And we pride ourselves on students usually enter the way that is best for them, but there's many ways in for students, if that is through, a head of house in the dorm, if it's through a faculty member, if it's through student support services, if it's through the medical department, and all the appropriate services will activate in assistance when needed. And this could be something, I don't want to trivialize anything, but it could be something as simple as I'm sick the day of my exam and can't make it this morning, and I thought I was fine, to a concussion, to an illness, to COVID, to a mental health crisis, and everything in between. And this service is amazing, and really we will work in each individual instance with students to guide them through that process.
Thanks, Sean. Karen, quick lightning round for you, because we only have about 3 minutes left. There's not currently a long COVID support group, is my understanding, but maybe a quick, how many interested students does it take to make a group in your experience to build that up?
Typically 8.
Perfect, excellent lightning round. And then Sean, the not lightning round, probably to finish us off, a number of questions here about visibility of vaccination status for roommates, and how MIT is handling the vaccinated, unvaccinated roommate question. If you have additional questions, I apologize, we're not gonna have time for them. You can always send us emails offline, but we'll have Sean answer and then we'll do a little wrap up.
Yeah, this is a great question. So as people are aware, we do have a masking requirement. In public areas of our dorms and residences, as well as campus buildings. It is true that students will not be required to mask in their rooms. We are advising with information with all of our community members on risk of vaccinated and unvaccinated, and knowing their risk. We are working currently with the Division of Student Life on an FAQ and some information around starting these conversations between roommates, having roommates feel comfortable managing some of these conversations and providing assistance to that. We will be having the aggressive testing program and other pieces that we will be using as well for mitigation of risk. I think, one important piece is our community members can be assured that all of our community members who are here have satisfied the vaccination requirement, but that can be that an appropriate exemption was obtained. There will not necessarily be private personal information shared of who's vaccinated and who is not. That certainly is something if a set of roommates want to share with each other and have that be as part of their communication and relationship building and guidance from the Division Student Life on this. We will be assisting in all of those pieces. As mentioned, we are largely 96, 7, 8% vaccinated. So very, very, very high percentage there. And we will be assisting I want to assure everyone, our entire community, both vaccinated and unvaccinated, in managing expectations and risk and other pieces as well.
Great, thank you, Sean. Well, we've just come to the top of the hour. If you have a question that we didn't answer, but you really need one, best place to do that is to send an email to medical@mit.edu. That's medical@mit.edu, and we can handle it from there. I want to take the opportunity to thank all of our presenters today, Karen, Sean, Katrina, Katelyn, and Greg working from the back. We want to welcome these students in advance. We know these are challenging and trying times. Our job is to make your students' MIT experience the best that can be. We're here to keep them safe. We're here to keep them well, and we cannot wait to welcome them over the next few weeks. So with that, thank you. As I tend to end a lot of meetings, please be safe and please wash your hands. We'll see your students soon.